I'm Dr. Nikki Weaver, audiologist and owner of Coweta Hearing and Balance Clinic and Fayette Hearing Clinic. Myself and my staff are happy that you chose us for your hearing, tinnitus, and dizziness needs. I started my clinics here in Coweta and Fayette counties in 2006 and 2007 because I wanted to share the information that I have learned about the ear and brain with everyone that I could in this area. I wanted to provide the best, most thorough diagnostic testing and the best help and options for those in our area who needed my help. After a few years of growth and practicing on my own, I added Dr. Bryn Witzman and Dr. Elizabeth Robinson to the practice. I was very fortunate to find two other audiologists who share my passion for what we do. Since opening in 2006 and 2007, we are proud to say that we have helped over 16,000 local residents with their hearing, tinnitus, and dizziness needs. We are locally owned, not part of any big corporation, and all of us are local residents. This allows us flexibility in the time we spend with our patients and how we help our patients. We are constantly attending symposiums and continuing education to make sure that our testing and treatment is the latest and best for our patients. If you have been anywhere else, you will notice a completely different and more thorough approach in our clinic, where we test every part of your ear and cognitive function related to your symptoms. Then we spend time making sure that you 100% understand your situation and treatment recommendations. Part of our passion and goal is to make sure everyone who sees us understands that hearing loss and tinnitus is not an isolated symptom. We used to think that hearing was just hearing, but now through recent research and studies, we know so much more. Did you know that hearing loss is related to diabetes, heart disease, isolation, depression, and dementia? We at Coweta Hearing and Balance Clinic and Fayette Hearing Clinic want to help every patient with hearing difficulties. We want to help more people to understand the importance of hearing health care, and we want to help more people to understand the unintended consequences of untreated hearing loss. Another personal goal of mine, having a son who shoots guns competitively and plays drums, is to make sure that everyone understands how hearing protection actually works. Unfortunately, 90% of people who use hearing protection are not protecting themselves enough from noise. Finally, it's important for you to know that hearing loss usually happens gradually, and the person with hearing loss often won't even realize that they have it until it's been present for years. You hear what you hear, but what you may not realize is that someone said something different than what you heard, someone said it louder to make sure that you heard it, or someone repeated it before you heard it. If anyone around you is saying that you need to get a hearing test, or if you are noticing any difficulty hearing in situations with background noise, any difficulty hearing a family member when you're at home or in the car, or have even occasional tinnitus, then I'm glad that you are scheduled to see us, because you mostly have at least grade 1 hearing loss, which can double your chances of getting dementia. And one more thing, please watch the following 7-minute video by our friend and colleague, Dr. Cliff Olson, about how the brain is impacted by even the mildest hearing loss. Myself, Dr. Bryn, and Dr. Elizabeth are excited to see you soon.